Hello, so I'm your host, Kazim Bibijon. I'm a specialty registrar in public health in the UK, and I'm really excited to welcome you all to a special series of episodes in partnership with the Faculty of Public Health to showcase the candidates running for the 2024 Faculty of Public Health elections. So we'll be joined by all the candidates for the President and Vice President roles, and we will be exploring with them what their vision is for the faculty and why members should consider voting for them. Voting opens on Thursday, the 14th of November, and closes on Thursday, the 12th of December. So in the first episode of the series, I have the absolute pleasure of hosting Professor Tracy Daszkiewicz. Tracy is a well-known and proven public health leader with nearly 3 decades of experience working across the public health system, including the NHS, local government, civil service, and the voluntary sector. Tracy has developed her senior leadership skills across a wide range of roles in her career, including as Director of Public Health at Wiltshire Council, where she played a pivotal leadership role in the response to the 2018 Novichok poisoning incident in Salisbury. She has also held roles as the Deputy Director of Population Health and Wellbeing at Public Health England and the Director of Public Health for Reading, West Berkshire and Wokingham Borough Councils. She is currently the Executive Director for Public Health and Strategic Partnerships at Aneurin Bevan University Health Board in Wales and is the current Vice President of the Faculty of Public Health and a visiting professor at the University of West England in Bristol. She's also a visiting lecturer at Exeter University and a trustee of the Swindon Domestic Abuse Support Service. Tracy, thank you so much for joining us and welcome to the podcast.
Well, thanks so much for the invitation, Kazim. It's great to be with you.
So in this episode, we're really going to be exploring your vision for, as president, potentially, of the Faculty of Public Health. So to start off with, perhaps, do you want to take through listeners why you want to be president of the Faculty of Public Health and why you put yourself forward for the role?
Yeah, I'm happy to. So I've been a member and then a fellow of the faculty for some time now and have been, as you said in the introduction, I'm the current Vice President, so I've held that position for the last 2.5 years, and it has been a fantastic opportunity. As with all of these things, we come into them with a welcome opportunity to make a contribution to our profession, but actually what you get out of it is far more than what you give. And I've had some brilliant experiences over the past 2.5 years in terms of the conversations I've been invited into and the pieces of work that I've been able to be part of. And that has crossed right across the membership, right across our regions and our nations, and indeed touched global public health as well. But what's been really interesting and what has been at the core of it is our membership. And that is everything right across our workforce at all levels. The support I've had also from registrars, particularly in the workforce wellbeing space and building the workforce for our future, has been incredible. So for me, the presidency would be an opportunity to continue that and also to fulfil my role and what I see as my duty around supporting that membership into the future over what will be a very exciting time for public health and how we can really start to continue to fix our position in that in terms of both how we support our communities, but also about how we support services as well from a public health perspective. And primary to that is obviously making sure that our membership are valued and listened to and getting what they need from the Faculty of Public Health and from myself.
Yeah, so really about that supporting the membership and that kind of contribution to the profession and that long-term plan. So I guess on that point, how would you kind of summarize your vision for the faculty over your three potential years, and what do you think will be your priorities?
So obviously I've had the privilege of being Vice President during Professor Fenton's time in office. So I've been part of building the current strategy and the current vision for the faculty. So key to that is actually taking that forward to its next phase and really understanding how we can build on that. Obviously, the Faculty of Public Health has a very clear vision about the right of everybody to have a long and happy life, a healthy life. So how we can continue to deliver that across our membership. Priorities about how we can link in across the workforce. So we've just what we've just been talking about is about the importance of how we need visibility of the faculty, how we can absolutely make that contribution to our members, but also hear what they need from us. So that for me will be a central priority about how we can open up the dialogue and make sure that the ideas and what is really important to the members of the faculty, what they're hearing on the ground, what their barriers to effective public health delivery are. But centred to that is how we build a public health workforce so that we can effectively tackle inequalities. You know, a lot about what we talk about in public health is the injustice and the unfairness that occurs as a result of where you live, work, grow, where you're born even, and how we can really tackle that. So staying focused on that. But it also spans across how we build a public health workforce and our public health offer. And that's everything from how we prioritise, how we inform that prioritisation, but also about how we train our members, the access to training, making sure that we've got a workforce that represents all of our communities, so all voices are heard within that. So I really want to open up opportunities for informal conversations. We've obviously got the formal mechanisms through the special interest groups, but one of the richest things I've experienced over the past 2.5 years is where I've gone into those very informal spaces of conversations and heard about what it's really like, what people's experiences are about working in public health. And that for me has given me a really good insight into how to take this forward. So my key priorities is about visibility. It's about making sure people's valued and making sure I'm listening and hearing people about what they want from me as president and how we can work together as a faculty to deliver good public health across the 4 nations, but also more broadly than that across the globe, and also how we can lean into other disciplines as well to maximise public health reach.
Yeah, so that kind of cross-working, that listening to members and kind of building that workforce that represents our communities and also addressing health inequalities. So I guess as you kind of mentioned our the membership of FPH already, in your sort of priorities and plan, how will you contribute to ensuring that the full FPH membership are supported across their career paths to meet not only current public health challenges, but those of the future?
Yeah, this is so important, isn't it? And I think, you know, if anything, the last 5 years, 5-6 years have taught us a huge amount. You know, we've from a public health point of view, stepping into a place of crisis, and we've had that whether we're looking at the environmental crisis, cost of living crisis, dealing with the pandemic, and obviously the long tail of the pandemic that will stay with us for some time. Public health, if it's nothing else, it is agile, and it needs to be responsive to changing needs of our populations, and also the way services are run and the way people access them. So keeping that at the forefront of our mind is absolutely key. But within that, it's also recognising the talents that we have and making sure that people are attracted to public health as a profession, but also how we keep really good people in the profession. And that is everything from how we support people as they enter this as a career. So people at the beginning of their public health career, recognising that most people that come into the training programme will have had a first career. So how we benefit from the richness and that diversity. You know, we're a multi-agency, multidisciplinary profession, and it's the richness that comes from that. So it's how we really value that within that, but making sure that people have got the best possible environment to actually learn and grow in the profession, and make sure that they've got the opportunity to bring all of that. And when issues arrive, make sure that we're ready to listen and respond to those. You know, we've got, you know, current issues and conversations that we're having around the examinations at the moment. That is a live conversation, but we, you know, making sure that we are here to support you as a faculty and support our members in all things. And one of the conversations I've been having over the past 2.5 years is around workforce wellbeing. And this has been really interesting. So it was originally brought about to look at possible burnout during the pandemic and how people have adapted to working at home and a more fragmented approach to work in many ways. Actually, the things that have come to the fore within that is around workforce fairness, parity of esteem, recognising this as a whole discipline, recognising the value of what everybody brings, regardless of professional background. And that's been a really rich and vibrant conversation. And I've had the opportunity to talk to a huge amount of groups within that, and a really lively registrar forum within that space that are really contributing about what it is like to be in training right now, what it was like to train during a pandemic, when you wouldn't have had exposure necessarily to wider opportunities that would happen had you been placed in offices. And also for those people that have been in public health for a period of time, how that changing practice happens, and how one thing that has come through really strongly is about how we can define ourselves as a discipline within our own right. We often describe public health about what we can do in an NHS context or a local government context. So we constantly define ourselves. We're like chameleons in a way. We have to define ourselves within the environment in which we work, where actually we need to really own our own identity, because public health brings something quite unique. So that is key for me in terms of how we can really build that and recognise that in the inclusivity around recognising the different systems across the 4 nations, recognising that people are at different stages of their career, and also spotting the talent around us that does that, and how we lead into other disciplines like environmental health, nursing, teaching, housing and planning, the built environment, nature and the green environment. We need all of these disciplines. They all make a contribution to public health. So having the opportunity to bring those conversations alive is really important to me.
So really, linking across the system, creating that identity of public health. I completely agree. That's very a unique field. And also, the comment about the diversity of professions is very unique as a specialty compared to other medical specialties, of the breadth of different careers that people come into the training scheme with is really really fascinating and unique. So a sort of last question for the episode. It's something that we explore on the podcast quite a lot as a theme around leadership, and registrars often are, in leadership positions not only during training, but obviously as they then enter consultant positions. So I guess in your experience, what do you think makes a good public health leader, and how would you describe your own leadership brand?
So I think my 4 rules, I suppose, for myself would be honest, be kind, know our purpose, and be brave. I think doing things a little bit differently, not being scared to fail, is actually okay. Just to do something differently to make sure that we're getting the best possible outcomes for, our role ultimately is to improve and protect the health of our populations. And sometimes you have to step outside of the norm to do that. Doing the same thing we've always done, if it hasn't already given us a change, then don't keep doing it, do something different. So bravery is key. In terms of my own brand, I always struggle with this question, because it depends what situation you're in, doesn't it? It calls on different things. You've got to constantly be responsive. But overall, I would probably say I am a servant leader. I take my position as being a servant really, really seriously, and whether that is serving my profession or whether it is serving my community or serving my organisation, it's always service. And I genuinely believe that the greatest privilege of leadership is service, and I think that is key, because if we're not delivering and we're caught in a place where we're merely describing, then we're not going to move things forward and make the change that we need to do. And I think the public health profession and what we're here for is too important to approach it with anything other than service and a commitment to make a change.
It's such a broad picture of public health. I completely agree about the service aspect, and I really liked your answer about those 4: be honest, be kind, clarify your purpose, and be brave, and don't be scared to fail. Tracy, it was an absolute pleasure to host you. That's the end of the very, very short episode, and hopefully provides a bit of a taste of your background, your experience, and your kind of vision for the Faculty of Public Health. It's been a pleasure to host you, Tracy. Thanks so much for joining us.
Oh, no, thank you. It's great. Thanks, Kazim.